Welcome to Health Matters. In today's edition, we talk about a subject that is particularly close to my heart, blood donation. There is a quote that says, "Heroes come in all shapes and sizes," and I hope today's episode will inspire you to be a hero and to donate blood. With us in the studio today is Dr. Ravin Rego, who is currently Medical Officer at the Blood Bank in Ushpicio, Margaon. He is a member of the Indian Medical Association and also of the St. Luke's Medical Guild. Thank you for coming into the studio today, Doctor.
Thank you for welcoming me, and it's my pleasure to speak on this topic.
Great. What is blood donation?
Blood donation is a process wherein we draw blood from a volunteer and transfuse it to a patient or convert it into a components of blood like platelets, red blood cells, plasma.
Okay. What's the history behind blood donation and blood banks? I know I'm going back a little bit in time, but before we move forward, I just wanted to understand, how did the concept come about?
If we go to the historical aspect of blood donation, history dates right up to 1628.
Okay.
Wherein William Harvey was a person who founded the concept of circulation of blood.
Okay.
In the same year, we had a scientist, James Lowry, who first demonstrated blood transfusion in dogs.
Okay.
By keeping a dog alive by transfusing blood from other dogs.
Okay.
So as you see in any medical invention is always has an animal trial. So also in blood donation we have it started with transfusion in dogs.
Okay.
Then later on in 1818 we had the first human blood transfusion, human to human, conducted by James Bundrell, a gynecologist and a physician.
Okay.
He transfused blood in a gynec patient who was bleeding profusely.
Okay.
In 1901, Karl Landsteiner was responsible for the blood group system that we have today.
Okay.
And because of his discovery, 14 June is celebrated as World Blood Donor Day.
Okay.
Then later on, as years progressed by, we had all the WHO intervention that made it compulsory to test the blood for 5 conditions. Mm-hmm. That is HIV, hepatitis B, hepatitis C, syphilis and malaria.
Okay.
In India, blood donation concept came about in 1942 during the World War II, where a lot of wounded soldiers required blood and they were transfused blood.
Okay.
The concept of the blood bank came about in India in 1942, where the first blood bank was established in Calcutta, now Kolkata. It was managed by the Red Cross. Okay. As the years went by, more and more blood banks started coming up in various cities and towns. As a result of which, 1975, Mr. G. Georgie, the president of Indian Council of Transfusion and Immunohematology, he established the National Blood Organization Day on 1st October.
Okay.
This basically was established to see blood banks, we require continuous supply of blood to keep them functional.
Right.
So the way we get blood today is only by organizing this blood donation camps, or what we call blood donation drives.
Okay. Okay. Now, are there multiple types of blood donation? Or is it just that one goes and donates blood and that's taken as
blood donation basically is of 2 types. Either you donate whole blood, or you just donate a component of the blood. That is, as I said before, platelets, RBCs or plasma.
Okay.
Now, blood donors, the types of blood donors are variety. There are various types of blood donors. We have a voluntary or a homologous donor.
Okay.
In this, basically, for example, I can just walk to the blood bank and give my voluntarily consent to give my blood.
Okay.
For which I am not paid. There is no remuneration for. There is also a targeted donor. In such cases, what happens is a family or relative comes forward, member comes forward to donate blood to a specific person.
Okay.
The difference between the two, in voluntary blood donation, voluntary blood donor doesn't know for whom his blood is given.
Right. Okay.
Whereas in targeted donor, it's target specific, it's patient specific.
Okay.
There is also the hybrid between the voluntary and targeted donor is known as a replacement donor,
Okay.
where you person who needs blood, he gets the blood from the blood bank, and that unit has to be replaced by either a friend or a family member.
That's usually what most of us respond to when there is a WhatsApp message that goes around saying,
yes,
okay.
Correct. And then we have a paid donor, concept of paid donor, which is against the law since 1st January 1998. Before
Okay.
that, what used to happen is whenever a person used to donate blood, voluntary or non, he used to get a monetary benefit, which
Okay.
is now against the law.
Okay.
Okay. Then there's something called apheresis donor.
Okay.
Apheresis donor is basically for platelet, to get platelet component from the blood. So what is being done is when a person comes for donation, through one hand his blood is withdrawn. That withdrawn blood goes through a machine, it's called centrifuge, where the platelets are separated, and the remaining part is given back to the donor.
Okay.
So these are the various types of donors.
Okay. Are there any physical conditions that a person might have that might require them necessarily giving blood? We hear of thick blood, things like that.
See,
Are there?
there is a condition called polycythemia,
Okay.
and I would like to bring to the notice of the public here. What happens many a times, the doctors, the treating physician, or they just give a blood and give a letter to the patient, go to the blood bank and donate the blood. See, in such cases, the procedure is not donation. It is what we call therapeutic phlebotomy or bloodletting, which has to be done under the supervision of a physician.
Okay.
Blood bank doesn't come into, has no role in this.
Okay.
For the basic reason, the blood which is withdrawn, it cannot be used for any patient. It has to be discarded immediately.
Okay.
So this is the only condition which it's not blood donation, but it's blood letting.
Okay. In what conditions would a blood transfusion be required?
See, nowadays, the basic reason for blood transfusion is anemia, moderate to severe anemia.
Okay.
Now we in our country, in Goa especially, we see a rising incidence of trauma cases, accidents, plus cancer. Cancer surgeries warrant blood transfusion. Then renal cases, kidney cases, a lot of kidney cases who undergo dialysis require blood.
Okay.
Plus antenatal, like there may be a postpartum hemorrhage which requires blood, and there's a ruptured ectopic pregnancy which requires blood.
Okay.
So basically there are 4 classes of trauma cases, renal kidney cases, then cancer cases,
and post-pregnancy.
post
Post-delivery
Antenatal,
rather.
post.
Antenatal, yeah. Okay. What are the categories of voluntary blood donors that you spoke about earlier?
A voluntary blood donor basically has 3 categories. The first one is, it's a new donor. He has never donated before. This is the first time he is donating.
Okay.
A second category is regular donor who donates every 3 to 4 months. Normal duration between 2 donations is, as per guidelines, is 3 months for males and 4 months for females. So if a person we have donors who come exactly every 3 months to donate. So they are regular donors.
Okay.
And there's a third category called a lapsed donor. Lapsed donor means I've donated today and I've not shown my face for the next 2 years. Suddenly I come after 2 years.
Okay.
So like, I've not kept that regularity of donation period.
Okay.
So that is called a lapsed donor.
Okay. Now, who is eligible to donate blood?
Now there are national guidelines for blood for eligibility of blood donors. First, age. Age is from 18 to 65 years.
Okay.
Basically, 18 years is the year we achieve our voting rights. So basically, that's why it's kept from 18 to 65. Gender, there are no any male or female can donate. Weight, as per guidelines, it's 45 kgs and above.
Okay.
You have to have a pulse rate of 50 to 100, BP of 160 to 90. So basically, person has to be a real healthy physically and mentally.
Okay.
Besides that, we have certain conditions where you may not be able to donate blood on the day you go for donation. Those are like temporary deferrals.
Okay.
For example, if somebody has taken a tetanus injection or any vaccine, he has to wait for 15 days to donate.
Okay.
If he has taken a rabies injection, he has to wait for 1 year.
Okay.
Similarly, if you have undergone tattooing or minor surgery or tooth extraction, you have to wait for 6 months to donate if you're for eligibility. If you have undergone any major surgery or any medical illness like say hepatitis A or hepatitis E,
Okay.
you have to wait for a year. Even if you have dengue, you have to wait for a year to donate. Then in females, if you are having your periods or you're menstruating, then till the menstruation cycle is over, you cannot donate.
Okay.
Similarly, if you are breastfeeding or lactating, till the first 6 months of exclusive breastfeeding, you cannot donate during that period.
Okay.
Now, third class of conditions are there which are permanent deferrals. You cannot donate at all.
Okay.
So these conditions, for example, a cardiac patient, if you have suffered a myocardial infarction or heart attack, you cannot donate. If you have undergone any cardiac surgery, you cannot donate. Then neurological conditions like epilepsy, then or Parkinson's, Alzheimer's, dementia, you cannot donate.
Okay.
Then thyroid, if you are suffering from thyroid disorders, you cannot donate. Plus, if you have detected as a cancer case, but now you are in a remission period, you are not eligible for donation.
Okay.
If you have undergone chemotherapy or any radiotherapy, you are not eligible for donation.
Okay.
Besides this, medicines. Now, medicines per se is like suppose if you have consumed steroids or antibiotics, you have to wait for 72 hours to donate.
Okay.
But there are certain drugs which, like if you are diabetic, that's a common question. If diabetic, can he donate? So diabetic per se, if he's on oral diabetic and his sugars are controlled, he can donate. But if you are a diabetic, you are having complications of diabetes, plus if you are on insulin and if your diabetes is not controlled, these are the three categories of diabetic patients who cannot donate at all.
Okay.
And besides this, there are certain drugs like steroids, you have to wait for 72 hours. Then if you that's what I said before, if you have taken any chemotherapy and all, you cannot donate.
Okay, so that's quite a laundry list of things that would preclude you from being able to donate.
Yes.
So is the onus for checking whether or not you should be going to donate on the donor, or is there an extensive search done when one goes to actually donate to ensure that they're getting good blood?
See, what is being done is when a donor comes to donate, we take a consent. We do a pre-donation counseling.
Okay.
So during the pre-donation counseling, we tell the donor all the eligibility criteria. Post that, he gives a consent that he wants to donate. We have had incidents when people have denied in the pre-donation council. So we have a second check when the physician checks the donor.
Okay.
The physician basically does a BP check, temperature check, pulse check, and he counter questions to see whether he is actually given the proper history or not.
Okay.
So based on that, we take the donors.
Okay. I recently donated blood about 3 weeks ago, and before they took me in to draw blood, they actually did a pinprick test for something.
Yeah.
What might they have been checking
See,
for?
I forgot to mention earlier, it's one of the criteria for donation is a hemoglobin, which is 12.5.
Okay.
So they check your hemoglobin. If it's below 12.5, you're not eligible to donate.
Okay.
But that doesn't mean you're permanently. If your hemoglobin is more than 12.5, you can donate.
Okay.
And earlier I had spoken about polycythemia.
Yes.
So what we do is we keep a range of 12.5 to around 17.
Okay.
If it's a person comes with a hemoglobin of 18, he may have done in private. We advise him to get a clearance from the physician with regards to polycythemia.
Okay.
Because he has to do further blood tests to prove that he doesn't have. In
Okay.
case he has, then he cannot donate. He has to be under physician's treatment. But if he is cleared by the physician, then we can take.
Okay. I'm going to digress a little bit, but talk about something that is relevant, and that is the types of blood groups and how they relate to blood donation and acceptance by somebody who is a receiver of blood. Could you talk a little bit about that, please?
See, we have basically 8 different types of blood groups.
Okay.
So blood groups are based on 2 antigens, that the A antigen and B antigen, and 2 antibodies, that is anti-A antibody, anti-B antibody.
Okay.
So basically we have A positive or A negative,
Right.
B positive or B negative, AB positive, AB negative, O positive, O negative. Now O negative is considered as to be the universal donor. He can, the O negative can donate to any blood group.
Okay.
And AB positive is supposed to be considered as a universal recipient. AB positive
Okay.
can get blood from any of the other this. Now before giving the blood to a patient, we do something called cross matching and compatibility checking, blood
Okay.
grouping cross matching. This is basically done to ensure prior to transfusion that the donor's blood and the recipient's blood are compatible.
Okay.
Because if they are not compatible, then we cannot transfuse that unit of blood.
So even in the case of it being the same blood group, there might be
Yeah,
a
there may be a
compatibility match issue.
compatibility issues because this is basically based on antigen-antibody reaction. There may be
Okay.
some other antibodies that is interfering with this, and that's as a result of which it may be incompatible.
Okay.
It's not just that you have a O positive and you have a O positive recipient. It's not that just you can just transfuse O positive to O positive.
Okay.
We have to do a blood grouping and cross matching.
Okay. Now, I've also heard of something called a Bombay blood group. Could you talk about that?
Yeah, Bombay blood group. Recently, there was a request in GMC for Bombay blood group. It's a very rare blood group. It was discovered in somewhere around 1952 by one Dr. Bende, who while examining the slide, he realized that the particular person did not have any of the antigens belonging to the ABO system.
Okay.
So that was it was discovered in Bombay. The patient was in Bombay. That's why it's labeled as Bombay blood group.
Okay.
Now the problem with Bombay blood group, a person with Bombay blood group can give his blood to any of the other groups.
But he's not
But he can receive only from Bombay blood group. He cannot receive from any of the, even O negative he cannot take.
So he
basically
is
it's a O, capital O and a small h. That's how we represent Bombay blood group.
Okay. So he is the equivalent of an O negative in terms of being able to donate.
Yeah, he'll be able to donate, but he cannot, he has to receive blood only from a Bombay blood group.
Okay.
No other blood group can.
That's also true in the case of an O negative?
O negative, from O negative, O positive.
Can be
Yeah.
received. Okay. Why is donating blood important?
See, bro, I personally feel donating blood is a good social cause. By one blood unit, we can save 3 lives.
Okay.
If not save, at least we can improve his lifespan.
Okay.
Another reason why people come to donate, there are many benefits of blood donation. When you come to donate, you get a free medical checkup.
Okay.
And we also do the screening test, as I mentioned before. So a person doesn't have to go to any lab when we do a free screening checkup.
Okay.
Second thing, donating blood also has effect. There are literatures which show there are decreased incidence of risk of heart attacks, reduced risk of obesity, reduced risk of cancer. So that's why. So these are all the benefits of blood donation.
Are there possible side effects of blood donation?
After donating, there are possible side effects. Most common we have seen is donor feels giddy, he feels nauseated, he vomits.
Okay.
As a result of which, this is more common in among the first-time donors. So
Okay.
what we do is immediately after donation, we advise them not to get up immediately. We elevate their limbs so that to cancel the giddiness effect post donation. Very rarely people they may have got a heart attack and all, but there's no literature or evidence to show that blood donation can cause heart attack.
Okay.
So, but most common is giddiness, nausea, vomiting. As a result of which, we always tell the donor never to come on fasting stomach. You should always have something, a light snack, and then donate.
Yes, they ensured that I had had breakfast multiple times. Yes. Okay. So therefore, blood donation is largely safe for the donor.
It is safe because we use disposable sets to collect the blood, and we test all the blood for the 5 conditions which I mentioned. So
Okay.
absolutely.
Now, there is something that used to be talked about more often, but I don't hear talked about very often now, and that is blood donor cards. So does donating blood entitle the donor to receive blood in the event that he or she needs it?
See, every voluntary donor who comes to our blood bank, we issue them a voluntary donor card.
Okay.
Now, what is the use? There is no what you call expiry date for the voluntary donor card.
Okay.
The main use of the card, it comes when you have to replace a unit. If we have sufficient stock, we accept the card. Only at times where if there are multiple, if a patient requires multiple units, then we take a mixture of card as well as replacement donor.
Okay.
And what happens is the card issued in a government blood bank is applicable, can be used in any of the government blood banks.
Okay.
Now the catch comes here, question we get here is sometimes what happens in GMC, hospicio donor card may not be accepted in GMC.
Okay.
Now this is not true for all cases, it's only true for cardiac cases where they require fresh blood.
Okay.
Fresh blood and component therapy, those two. So because the donor card is given in our hospicio, it's given for a whole blood donation.
Okay.
So those are the only 2 cases they don't accept.
Okay.
So but the donor card concept is still existing.
Okay.
Besides the donor card, we also give a blood grouping card for the donor, so that he has in his record what is his blood group.
But you only get the card if you're a voluntary donor, not if you're a replacement donor or anything. Okay. Now, you talked about components of blood, and I've been doing some reading on platelet donation and how it enables a person to donate platelets as frequently as every 2 weeks versus the usual 90 days to 120 days for males and females. Also about the fact that the separated blood is then pumped back into the donor's body and only the platelets are extracted. How does the process work?
See, what you have said is what we call it as apheresis.
Okay.
That's what I had explained before.
Yes.
Apheresis, the blood is drawn up from one hand. It goes to a machine where it's centrifuged and the platelets are separated, and the remaining part goes back to the donor. Now platelets, the difference between whole blood and platelets, one difference is platelets, they remain only for 3 to maximum 5 days. We can keep that only for 5 days.
Okay.
Okay, whereas whole blood, the expiry is for 35 days.
Okay.
Okay, internationally they keep for 42 days,
Okay.
35 days. Another difference is whole blood donor has to donate after 3 to 4 months. Whereas
Okay.
platelets, you can donate once in 14 days or even minimum once in 7 days.
Does
So,
that mean platelets are regenerated by the blood that
yeah,
quickly?
yeah.
Okay.
And only difference is apheresis is a longer procedure.
Okay.
A normal whole blood donor will complete the process maximum half an hour.
Mm.
The donation part only takes around 10 to 15 minutes.
Correct.
Rest is all the paperwork and all the documentation
Yes.
consent. But apheresis can take as long as 2 to 3 hours. So
Okay.
that's the only, those are the three differences.
And that's because the centrifuging is
yeah,
happening
because
at the same
the whole
time
entire
as
process,
extraction.
right from,
Okay. Now, is platelet donation available in Goa?
yeah, see in Goa, basically government setup, we have 3 blood banks. One
Okay.
is Hospicio, Asilo and GMC.
Okay.
Hospicio and Asilo, we only licensed for whole blood.
Okay.
GMC is licensed for components as well as whole blood.
So, apart from these 3 locations, is there anywhere else that a patient could go to donate blood?
There is one private blood bank in Manipal, which is licensed.
Okay. So, essentially 4 blood
So
banks
essentially now 4 functional.
across Goa.
Yeah.
Okay. Now, I've been looking up statistics also, and it says that in the last few years, India has seen a huge improvement in blood collection. But despite that, it says that we are staring at a deficit of about 1.95 million units. 2 questions to this. One is, how do you measure a deficit in units? So, is that against a projected, forecasted requirement annually? And the second is that, are there any myths that keep people from donating blood?
Yeah. Now see, in India annually the requirement is around 12 million blood units.
Okay.
But India has achieved only around 9 million. So there is
Okay.
a deficit. Now regarding myths, there are a lot of myths. Like ever since, first thing they think blood donation is a painful procedure.
Mm.
In this regard, I would like to say it's not a painful procedure. The only pain you get is when you get the prick of the needle. Otherwise, once the flow is standardized, normal, you will have no pain. So it just, but I always tell my donors, we have to think the pain the patient suffers who requires the blood.
Mm.
He has been suffering pain all these years, all these months.
Mm.
So, is it the pinprick pain is better than that pain?
Mm.
So it's like this. We have to think.
Mm.
Second thing is, another thing I've observed is whenever they come to donate, they check their weight before donation and after donation.
Okay.
So
Okay.
I don't know whether they want to check whether there's a rise in weight or a decrease in weight.
Okay.
The normal thought process would be once some 350 ml of blood goes, my weight will reduce, which is not the case.
Right.
But for donation, 45 kgs is the cutoff.
Mm.
And third is mainly diabetics. They question us whether can we donate.
Mm.
So diabetics, as I've said before, there are 3 conditions where you cannot donate in diabetics.
Yes.
If you are suffering from any complication of diabetes, where be it peripheral neuropathy, be it nephropathy, be it retinopathy, you cannot donate. If you are a diabetic on insulin, you cannot donate.
Okay.
If you are on oral diabetic drugs, then your sugars have to be controlled. We always ask for the past 1 week sugar on fasting sugar report.
Mm.
So, and if you are having multiple problems like diabetes, hypertension, heart problems, then you also cannot donate.
Right.
Okay. Fourth, one more myth is people don't come forward to donate because they find it's a time-consuming process. See, the problem is the donation process doesn't take time. What happens is in a camp, usually you cannot take too many donors at the same time. You can only breed one donor at a time. So in such cases, what do? Once the person registers, we see the time, how much time will the people before him take. So accordingly, we tell him you can come later to donate.
Okay.
So that's how we cut on time. Now the apheresis process is a time consuming but we cannot help it.
Okay.
So those are like special cases where they come to donate. It's not.
Okay. Thank you. I think that's been a fairly comprehensive view on blood donation. Is there anything that you would like to say specifically to our viewers in terms of addressing them on the subject?
See, blood donation is a good, noble social cause. With one donation, we can save either 1 or 3 lives. Even people who come for blood donation, they may not be eligible to donate, but I always appreciate their thought of helping someone who is in need. It's the thought that is more important. And once you donate blood, there are a lot of benefits of blood donation to your health as well as to the recipient's health. So I request a lot of you, mainly the college students, to come forward, and once you achieve the age of 18 years, you can walk into any blood bank to donate blood. If it's not possible for you to walk into the blood bank, we organize a lot of blood donation drives. So any venue you can just walk in and donate your blood.
Okay. You said you can save 3 lives with one donation. How does that happen?
See, is either whole blood or the whole blood you divide them into components.
Yes.
Plasma, RBCs or platelets.
Okay.
So
and all 3 can be separate donations.
Yeah. So one person can receive platelets, one person can receive RBCs, one person can receive plasma.
Okay, great. Thank you so much, Doctor. It's been very informative. And if you are watching, I hope you've been convinced about the fact that blood donation is truly a noble cause and is an easy way to perhaps save a life. And remember, you are somebody's type.